Hello and welcome to the Pre-Chiro podcast. I'm your host, Dr. Ben Glass, and today we're making a professional chiropractor connection out in Tennessee with Dr. Callie Seymour. Callie, can you just get us started by reflecting on what attracted you to this profession and this path, why you decided to become a chiropractor?
Yeah, of course, Dr. Ben. So I think really I'd always had a bent towards health and wellness. And pre-chiropractic, I was, studying biology, and I was, doing a lot of personal training. I was building up my personal training business. I danced professionally for 2 years. And as I was dancing for the NFL, actually, way back when the St. Louis Cardinals were an actual team before they moved to Phoenix. And I was a cheerleader for them, and I injured my back. And it was through that injury that I went to my first chiropractor. And of course, I had never, maybe not of course, but in my situation, I grew up very allopathically. So when you hurt yourself, you go to an MD and you follow either a prescription protocol or rest or whatever it is, but there was no mention of chiropractic. And so this was new exposure to me, but it was eye-opening. I mean, on so many levels. The only option that was given to me for my injury was surgery. And of course, that I was 19 years old at the time. So having a massive surgery for something that was able to be treated conservatively, and that option was never given to me, that was puzzling. So right off the get-go, I thought, well, wait a second, why was that option not given to me when it was ended up being the best option for me? So through that chiropractic experience, I got on my own first treatment plan. Thankfully, I went to a chiro who understood the necessity and the longevity of doing an actual treatment plan. This is not just a one and done kind of thing. And this chiropractor also was pretty philosophically strong. They were telling me this is not just about pain, this is about your health. So through that, I actually changed my entire profession, stopped all that and went into chiropractic school. And then for me, it was 9 years later, I ended up opening my first practice in St. Louis, Missouri.
Can you talk to us and just give us some insights into some surprises you encountered or challenges you faced of having changed your career path completely, whether it was telling your friends and family you were going this route, and maybe they didn't fully understand, or it was just showing up in chiropractic school and being surprised by the educational experience? If you could maybe just reflect on those times.
Sure. I think, thankfully, most of my family was pretty supportive. I had a few that weren't or just didn't understand, why I would choose this as opposed to something else. but some of them were in the pharmaceutical industry, so it made, it now makes sense why they were so puzzled by my choice. Although now they're not only 100% on board, but actually have that same lean or that same propensity. I think the biggest challenge was I was so passionate and so wide-eyed and excited. And I just thought opening my first practice was going to come with a lot of ease. And it didn't. I won some awards in school and just had all kinds of potential. And when I got out there and it was a little harder than I realized, I think that was a little eye-opening for me. Not completely discouraging though. I mean, I was bent on, this is it. This is the call on my life. This isn't just my job. And and that's always going to come with an element of surprise. It's always going to come with an element of it being harder than you thought. And so you but if you know that going into it, it maybe is easier to navigate those times. But even if you don't, you can learn pretty quick. Hey, there's a lot here that I don't know that they didn't teach me in school. And so, yeah, I think, and I met a lot of different people in school, in Chiro College, that they had just completely different backgrounds. Some were from a background similar to me. Some had grown up chiropractically, so they didn't know anything else. Some were super passionate philosophically, some weren't. So it was really, I more took the role of observer and kind of looked to understand and to see why there was this chasm really in the profession. Why is there this huge gap, both philosophically and even logistically, about how people want to practice when they get out. And I think that's one of the beautiful things about chiropractic also is there is so much diversity in what you can do with this gift. But the lack of unity is problematic in our profession when you find out how few people we're still seeing in the big picture, even practices like that are super high volume, and we're considered a high volume practice, but even that is just the tip of the iceberg for the population that isn't being treated through chiropractic. And that's really the mission, is like, how can we get this message out and help people understand what a tremendous healthcare choice this really is. And if it were the front line, what would that do to healthcare? So I think in terms of getting started in the career, it is really, really important to surround yourself with people that have been through it, that are philosophically strong, and that can help you kind of navigate those rough times so you don't quit. A lot of people quit too early. We have tremendously passionate chiropractors who lost their practices during COVID, and it didn't need to be that way. There was a lot that could have been done prior to that. So.
Mm-hmm. I think that's a great segue into you reflecting on the people you surrounded yourself with going through school. Also, you touched on that you had won awards in school, and that when you got out of school, maybe you recognized that those awards weren't as important as maybe some skills that you could have prepared yourself to actually express out in the world once you got out. I'm just curious if you can speak about kind of how students might be not distracted, but led down a path of being told that certain things are very important when maybe when you get out into the real world, you realize they're not. And then, yeah, just to reiterate, who are you surrounding yourself with? Who are you attracted to, become running partners with, as far as like a tribe or a group of people or friends of yours? And how did you support them? How did they support you?
Yeah, great. That's such an excellent question. And I think a really important for us to think that through as we're, or for students to think through, especially as they're going through school, and even for docs that are already out. I think initially the people I surrounded myself with were colleagues. So I was an associate for 6 or 7 months while I was waiting for my build out and all of that to open my own place. And interestingly, it wouldn't have been, the associateship was great because you learn a lot clinically, but I realized that I wanted to surround myself with people who didn't just have my same interest, but who shared my same values. That was really important. So having a few positions where they did not share my same values, it wasn't, for me, it's God first, and then it's my family. My work is a huge part of who I am, but if I'm not super careful, it can consume the majority of my time and the majority of my energy, because I am super passionate about it. So having people to surround myself with that were extremely clear in their value system, that helped me to really stay on track. So for me, that became a management firm that really resonated with my core values, which are faith and family, and of course, doing the very best that I could for my practice, for my patients clinically. So I wanted people who were ethically and morally, who I deemed very solid, and who really focused on chiropractic philosophy. They weren't just in this for money, or they weren't just in this for accolades or whatnot. And back to your point about school, it is really important to understand your stuff. You got to learn your stuff clinically. But the awards and things that you get in school that are peer-based or that are academia-based only will not sustain you in practice. You've got to have people skills. You've got to have empathy. You've got to develop a skill set of really understanding a patient, where they're coming from, and being able to meet them right where they're at, and take them from, hey, maybe their entry point might be pain, or it might be whatever, but it's usually going to be pain in this profession. Maybe not in 10 years, it may be all wellness, but many people that come to you for pain, they need you to be able to transition them from pain to wellness at some point. And that requires your communication skills. So when I first opened my practice, again, I only surrounded myself kind of with other people who were already trying to figure it out, or who were mentors who maybe weren't really mentors. They were just hiring me to do the job for them, but they weren't really imparting from a value system that I would honor. So I found after about 6 years in practice, I ended up meeting a group of people called AMC, and that system resonated with me. Right now, I instruct for them. I'm one of their instructors, and they have a system that's really, really helped many practices just get going, get started. It's a faith-based organization, so their value system resonated with me. And now I'm also a member of Christ-centered chiropractic, which I love that so much because these folks have extremely high-level concepts. And so I find that they really challenge me to take things to the next level in a way that I couldn't do myself. So those are two, resources. My husband builds Chiro websites and he's super philosophically strong. So I do think, just like you would tell your kids, if anyone has children out there, one of the things you start to train them in is, hey, you'll become like who you hang around. So who you pick for your mentors and for your professional relationships is extremely important. And I'm just one that believes that your first 10 years in practice, at least, you really need to be part of a group. You've got to have the camaraderie. You've got to have the support, the encouragement. You've got to have someone to call and say, hey, this is a mess. What do I do? But then you've also got to have people who are going to encourage you not to get complacent in this. Because once you reach a measure of success, it's easy to kind of get complacent in that and not be as focused as you normally would on saving the world, like you were the first couple of years out.
Mm-hmm. Can you speak to that individual who's maybe growing up in church and build that bridge between chiropractic and coming from a family or from a background that's rooted in faith? And also, can you elaborate more on what AMC is and also Christ-centered chiropractic, maybe just helping people better understand these resources that are available that they might not be aware of?
Sure. So I think from a faith-based perspective, one of the most attractive things about chiropractic to me and to many of my patients has been that the principle of it is really that God made the body to be self-healing. And that as we remove interference in its ability to self-heal, or we remove interference that's kind of creating obstacles to that healing process, and then we back off and let the body do what it was naturally meant to do, that philosophically just resonated with me tremendously. So it's been wonderful to match my faith with my occupation, because it just makes so much sense to me. God's made our bodies to heal, and because of that, He's given us tremendous wisdom as to how to care for them, how to nurture them, how to align ourselves and our behavior with what's going to promote healing. And so I do really emphasize that with my patients. Listen, there's a way that your body was made to work, and it wasn't made to run off of certain things. So you can't fill it with certain things and expect it to work. You can't go around with spinal subluxation and expect the brain to be communicating with the body well, because that's not the way it works. So, the principle, I think, for me is already very faith-based, because you're working with the innate ability that God put in our bodies to be healing and to sustain healing until we take our last breath, which obviously we're all going to do. In terms of the groups, yes, AMC, Christ-centered chiropractic, and another one I want to throw out there, Roberto Monaco is my speaking coach. And I found one of those early skill sets that I was missing was the ability to communicate clearly. And I would get asked to come into an organization and maybe do a free health talk or something. And I would piecemeal it together myself by what I learned in school, and it just wasn't as effective. So hiring him has been phenomenal. And he's got a program, influencing from the front, that you can go and spend an immersion weekend with him and really get that training started. I think that's one of the first skill sets you need outside of your clinical proficiency. You've got to be able to communicate, because that is how we get the word out. That's how your patients are going to understand what you do and align with that and see the benefits of that in their own life and in their own health and in their own circles of influence. But it's also how we have the opportunity, if we choose to take it, to really change things in healthcare. because we've got to go out and explain what we do. And a lot of people are still really confused about what we do. The thing I like about the other two groups that I mentioned, AMC and Christ Center Chiropractic, and they are different. They are both they are both coaching programs, but AMC is more systems. Like, they're going to teach you how to get your practice up and going. They're going to teach you how to run it, protocols and procedures that maximize your patient interaction and maximize your results with the patient, because they're going to free you up to be a great doctor. They're going to help you train your staff and get your systems in place so that you can really take people from that initial phone call all the way through, my life has changed because of my chiropractor or my chiropractic care. Christ Center Chiropractic is also a phenomenal organization. It's just a little different. Their structure is a little different, and they don't maybe these are my spiritual brothers and sisters. Let's put it that way. These people are so strong in their faith walk and in their passion for chiropractic. They've really imparted to me kind of the encouragement to go to the next level in my walk with the Lord and in my practice, and in kind of really believing for the miracles that can actually happen every single day in your practice, and not being kind of pushed down by the mundane, the job's not done until the paperwork's done kind of stuff. So Christ Center Chiropractic, I consider them mentors, really tremendous spiritual mentors. Dr. Ben Lerner, Dr. Rob Schiffman, I think Dr. Eric Lerner's now coaching with them as well. And they really, they just impart this greater measure of excellence and of faith and of stretching you beyond your current concepts. So both great companies. Again, I instruct for AMC now, but I used to be a client of theirs, and now I am a Christ-centered doctor. I've spoken at one of their events, but I'm being coached by them. And I always think no matter what level you reach, it's really helpful to have coaches in your life that stretch you. We're never going to get to a point where we don't benefit from that or need that. So to take the role of learner, even though I'm teaching in one capacity and I have my own coaching program, so I'm coaching people, but it's health coaching, then I have coaches around me that are constantly pulling me up to a higher level than I could ever achieve on my own. So
can you talk about and tease out the details of your practice? You've worked really hard to really crystallize the vision that you're now expressing through your clinic. Can you give students not only the front end of like the care that you're providing for people and how you're providing for it, but also the back end, just so that we can expand their understanding of like what it means to be in chiropractic practice from the inside out?
Yeah, of course. There are a lot of different pathways you can take. So if you want to open your own practice, again, you can just jump out and do that and have that be your practice forever. I would say focus first before you diversify in a whole lot of things. Focus on subluxation-based chiropractic. Get excellent at your skill set. Be an incredible adjuster, whether you're a hand adjuster or you use instrument. Get your neurology down, get your x-ray ability to diagnose and read x-ray or refer that out. But you've got to get those things in place, because that's what's going to change lives first. While you're doing that, get your communication skills in place so that you can go out and do some public speaking or do your patient orientation classes internally. Then once you're really solid in those things, then you can begin to add those other adjuncts. You can add nutrition, you can add therapies, you can add modalities, you can add those things, but don't ever do those as a quick fix to not being a great adjuster. Okay, that's all. I mean, I'm all for multidisciplinary practices and integrative care. I'm hugely into that. I love that. That's what we do. But when I first started out, doing too much of that too soon marginalized my focus. And I feel like I got a lot better when I cleared the plate and stayed very subluxation centered for a good solid couple of years. And then I began to add those things back. So I had my own practice in Missouri for 12 years. Then I moved to Georgia practiced for a few years in Georgia, but I happen to have the incredible benefit and tremendous blessing of my brother-in-law and my niece are also both chiropractors. And so we decided to combine together and practice together. So I'm at their clinic in Chattanooga, Tennessee, called Scenic City Clinic of Chiropractic and Nutrition. And it's a full wellness center. So we have chiropractic, we've got clinical nutrition. We do something called stress response testing. We've got weight loss. We've got a physical therapist on our team there. We've got a counselor. So it's really a full wellness center, but we stay in our own lane. Like we've got all that thing, all those things that we can provide for patients, but we keep the first thing first, and that's the chiropractic is first, because that's what's going to change the brain, primarily. And then we add everything else around that to support what we're doing. And I do think our patient results are tremendously better because we integrate all of that. But again, we do it from a core foundation of chiropractic is first and everything else supports it.
Mm-hmm. Can you talk about a couple of stories of being able to help people, and also maybe just your connection to the community when you show up in a town? It sounds like you've been in a couple different places, but like the value of being a chiropractor is also that you get to really connect deeply with your community. Can you just talk a little bit about some experiences you've had in the clinic and also in your community, just to help people better understand what it's like to be a chiropractor?
Yes. And this is the fun part, because clinically, sometimes you can, if you see, say whatever your volume is, say that 80% of your patients you see that day are doing phenomenal, they're doing great, but there's one that's just struggling still. That's the one you're going to think about when you go home. So you really have to be intentional about focusing on the lives that are being changed through what you're doing. I mean, we do gather testimonials quite a bit. So we've got the opportunity to hear from people at these check-in points, how they're doing and how this has changed their life. One in particular, family that I'm thinking of, the mom came in and she was struggling with migraines so severe her whole life that it was literally shutting her down for weeks at a time. She would have to be in dark rooms and miss all of her kids' events and not, have an intimate life with her husband. And just, it was impacting her life tremendously. And she was on several different medications. Right after receiving her first week of chiropractic adjustments. Now we do upper cervical care here. We do full spine, but we are atlas orthogonal adjusters. And that's a whole nother story too, which I'll get into in a moment. But her migraines improved to the point where she literally felt like she got her entire life back. And she would come in tears, just, thank you so much. You guys have saved my life. And we're like, well, it wasn't really us. We just removed the interference that was on your brainstem and now your headaches are gone. But because of that, that's not what she's thinking about. She's not just thinking my migraines are gone. She's thinking my marital relationship is better. I can be who I want to be for my kids now. And now I can actually feel like I have a life worth fulfilling instead of one that I want to hide from 2 out of 4 weeks per month. So it's those kind of things. And we just take it for granted. You're just moving the bone off the nerve and seeing what happens. And then when people come in and you're like, no, you don't understand. It changed my entire life. Now I think of another patient, trigeminal neuralgia, which is tremendously painful, face condition, face pain, because of pressure on that trigeminal nerve. And she had a spinal fusion already. So she was really given no hope that there was anything else that could be done except for living on these neurotoxic painkillers forever instead of just temporarily. And when she came to us, she was distraught. She was suicidal. She had already attempted twice. And she wrote a testimony for us and gives us full permission to share. Of course, I won't use her name, but her testimony is very public already. And she literally, if it didn't work, that was going to be it for her. And so thankfully she's doing so much better. And we're not even limited by the fact that she's got a cervical fusion. We could adjust the atlas, really from occiput through C3. We could have tremendous effect on that. And it definitely took care of her trigeminal. She has maybe 3 flare-ups a year now, where this was constant and chronic for her before. So this is life-changing. And no matter what limitations they come to you with, there's almost always something you can do. There's very few times where there's a patient that we have to turn away and say, literally, there's nothing we can do for you. If they're willing to be compliant, their body has tremendous healing potential, and we're going to work with whatever we've got. We're not going to, anyway, we're going to assume the best and hope for the best and let the chips fall where they may. But 9 times out of 10, you can help everybody that walks in your door on some level. Some people are going to be completely healed, and that'll be it, and life-changing for them. And some people are going to get a measure of healing that now changes the dynamic of their life and the quality of their life and prevents drugs and prevents surgery. And all of those things are things that you get to see every single day in practice. And there's very few professions that are that rewarding.
Yeah, can you elaborate on atlas orthogonal, upper cervical? And then I just want to tell you a quick story. I was in the park yesterday with my son, and I was watching him play with another young kid. And the person who was watching that young kid, we got to talking, and I'm passionate about just introducing people to chiropractic, not only to see if I can help them, but also to see if maybe they want to become chiropractors. And after, I don't know, 5 minutes of her telling me she wants to go into a healing profession, she wants to become a healer one day, I said, well, have you ever thought about chiropractic? She said, no, I want to do something neurological. And I said, oh my gosh, can I film you saying that right now? So it's just wild. You mentioned neurology a couple times. I'm sure that's going to be wrapped up in what you talk about with upper cervical. But can you introduce students to how influential neurology is into the healing process and how we see the body through maybe the neurological lens?
Yeah, sure. Sorry, I'm trying to figure out how to frame this up here. Neurologically, because the brain controls everything, and because the research is now to the point where we can substantiate a lot of what we're saying about subluxation and about how the brain chemistry actually changes when there's pressure on nerve roots and when there's pain syndromes that are chronic, it literally changes the way that your body or that your brain perceives your world. And so with atlas orthogonal, we do focus primarily on that brainstem level, that the atlas bone, and keeping it orthogonal or parallel to the occiput and to C2, and making sure that the brain can send and receive signals without interference, primarily at that level. And then we do full spine as well. We do instrument full spine adjusting, but to also remove those lower segment subluxations, which are life-threatening as well, but I would argue not near as much as the upper cervical level. Now, when I was back in school, I did graduate as a full spine adjuster diversified. So I started out my whole first 10 to 12 years in practice where I was a manual adjuster only. Now thankfully, I learned in school just from going to Neuro Club how important the brainstem level was. So I did get really good at setting an atlas. But I didn't get quite the same correction, pre and post films correction and actual condition level changes rather than just pain level changes. I didn't get those kind of results with diversified adjusting. I did do a little bit of Gonstead, but that was never my main focus. A lot of my friends are Gonstead adjusters to this day, and they're seeing tremendous results. I think because it's so specific. It's not just gross motion in the spine. But once I transitioned into instrument adjusting and learned about the different upper cervical techniques, atlas orthogonal is the one that we land on. For a host of different reasons, the X-ray specificity is so clear cut. It's very easy to, it's not that it's easy to learn, but it's easy to duplicate or replicate. So once you get your measurements right, any doctor that's in that position, as long as they know how to set the patient up and they're using the correct measurements, any physician can get the same clinical result. So it's no longer, personality based or just sensory based. You can actually measure the pre and post changes. So we like that level of correction for patients instead of just pain relief or gross motion. We're actually seeing corrective changes on our x-rays. So we do pre-x-rays and then we do post x-rays or incremental, and we do expect to see positive changes on film as well as changes in their symptomatic presentation. But a lot of times you're going to see the changes on film first before the symptoms are gone. And then you have some patients that their symptoms will be gone, but their x-rays aren't corrected yet. So that's where we can intervene and say, listen, I know your symptoms are gone, but according to this film, they will be back if you don't keep going. And so I really like the specificity of that. The other thing I like is there's a lot of longevity to it. With manual adjusting, sometimes your body will wear out, sometimes your shoulders will wear out, or your low back, and you've got just from the constant repetitive overuse. So it's nice to have these options or to learn these different things. But I would never let go of my manual skill set either. To say I'm on a mission trip and I don't have x-ray and I don't have an instrument and I don't have electricity, I want to be able to palpate that spine and go with my innate and know exactly where I need to go and adjust it as best I can manually. So there's a lot of different skill sets that you want to have, all of them in your bag, but you just want to pick one or two that you focus on and become the best at.
Can you reflect on some mission trip experiences that you had in life and just kind of give some context as to like why mission trips can be very valuable in your process of developing yourself?
Yeah, absolutely. So unfortunately, I don't have a lot of missionary experience outside of the US. I have been part of a few groups that have gone to help, particular communities that there's no way they could pay for care. And we've just done a lot of complimentary chiro work for them. But that's, we've done a lot of homeless, homeless communities where we'll just go set up tables. And I did do this through some organized groups, both in Georgia and Missouri. My daughter actually has done overseas missionary work, and she would kind of be the first to tell me, man, if we had a chiropractor over there, that would be tremendous. I know Dr. Auda Tavor has a chiro missions that she does a lot of that. I had cancer, and I don't get vaccinated or anything. So a lot of the overseas work I couldn't do because of not accepting the vaccination to be able to do that. Hopefully that'll change. I'd love to do some of that. But in the meantime, we've got so much just in the US here, so many different communities that maybe don't know about chiropractic care or aren't able to do it. And occasionally, if you just get a good group of chiros out there and begin to treat people, even their lives are going to be changed, even if they're not on full treatment plans.
Mm-hmm. What's your vision for yourself? You're still really young and you've got a lot of experience, and obviously you're in the flow, you're in a very dynamic, it sounds like, lifestyle. Where do you see the next 10 to 20 years, maybe for yourself, maybe for your clinic, maybe for your family, but also for the profession? Just because it seems like you are very engaged with the profession, just curious what your thoughts are.
I think we have the most unique opportunity that we've ever had in history to get chiropractic out to the masses. I think we're at a very crucible moment where you have a path to pick. You're going to be subluxation based and philosophically strong, or you're not. And we really need a core group that is, and that can take this to the masses, because it literally will be the healthcare solution of the future. It is right now. But if we were the entry point, it would change everything for healthcare. So I think now more than ever, it's time to really stay in unity and rally together and lean on each other and support each other and get this tremendous blessing of chiropractic out, get the word out in our individual communities first, and then out to the masses. So that really becomes us taking on the responsibility of becoming the community wellness leaders. And that's going to mean getting out and doing public speaking. And that's going to mean doing some service. And that's going to mean connecting. And it's going to mean doing talks in your office. And it's going to mean taking care of yourself. And I think that's huge. I think for the next 10 to 15 years, if chiropractors really take on the role of saying, hey, I am the community leader. And leadership first starts with leading yourselves. So that means you've got to create that balance, those boundaries, that structure in your own life to where you're managing your health, you're there for your family, and you're creating the culture in your practice that's mission oriented. I think if you let your team just come and go to work every day and they don't understand the mission that you're on, then I think we failed in that area. So I think we've got to really take that position and take that authority that's already been given to us and just begin to walk in it more. And I think we can. I think if we do, I think we're going to see a tremendous change in healthcare. I'm not one that thinks the career is going this way. I think it's going this way. And I've seen that, and some of the passion in some of the students that I've already interacted with. I think the profession's headed in a really great direction, but there's also a segment of it that is very negative, and they're not philosophically strong, and they have the tendency to pull the wrong direction. So I think moving into the profession, be very, very careful about who you're hanging around and what they're feeding you, because there's a lot of us that are seeing miracles every single day in our practice and that believe that we are the front line of healthcare.
Can you just talk a little bit about having your daughter go to become a chiropractor, and also just like your lifestyle, the freedom and flexibility that you get to experience as a chiropractor, but also that legacy of now having your daughter become one, and maybe just some observations you've made, just having you, how has that really helped her, and how is like having you from, not even just day one in her life, but also just day one in chiropractic school really maybe accelerated something inside of her.
So she's actually not a chiropractor. She did missionary work, just faith missionary work. She did with Compassion International. She's not a chiropractor. She just loves chiropractic, and she's been adjusted all her life. And this is my 28-year-old. I've also got a 13-year-old who's grown up and being adjusted since she was born. So they don't know any different. And I do think they argue this too. I mean, their health continence is definitely stronger. I think stronger than what it would have been before. But I think my oldest daughter's been on antibiotics twice in her whole life, and she's 28. My youngest has never been on antibiotics, not even once. And so it's what they do. It's what we know. I've got a table down in our bedroom, and at least one time a week, everyone gets adjusted. And my oldest daughter, even though she's moved out, she sees a chiropractor that I trained when they were in school. And so it is a legacy in that respect. But it's not what they do for work, but it's definitely what they're passionate about, and they're on board with this lifestyle and with my mission and the call on my life for sure. And we just live this way. It is our lifestyle. Chiropractic is part of our healthy lifestyle for sure.
I didn't realize that you worked with students. Can you kind of maybe just tease out some of the biggest insecurities they have, or the biggest inner things that they need to work out for themselves that you see maybe repetitively showing up in the coaching that you do, or the patterns that you observe within them of maybe some blocks, some inner challenges or inner subluxations, maybe to their mindset, or just to their path? Like where are people challenged in this path?
Yeah, it's a great question. And the answer is very diverse, but I do see a lot of conceptual challenges of wanting to quit too soon as things get hard. So I think just really building some resilience needs to happen. And concept wise, there is a lot of negativity sometimes that's being put on these students. Like, hey, it's going to be so hard. It's going to be, and it is going to be hard, but that's this much of it, right? Yes, it is going to be hard. And here's how you fix that. Here's how you navigate that. Just be prepared and be realistic about it. And we'll show you exactly how to work through those hard points, but that's no reason not to do it. I think one of the other concepts is that maybe this is for pain and not healthcare, not longevity, not wellness, not mental health. I think that's super exciting when they learn, when they have that aha moment. They're like, wait a second, what do you mean this affects depression? What do you mean someone with depression can get better through chiropractic care? What? I thought this was back pain and headaches. One of the positive things I see is this energy to change things. Like I see these students being like, yes, this is not okay what we're seeing in healthcare. And we are going to get out there and do something about it. Teach us, just tell us what we need to do. We'll go do it. And so I love that. I do think this is a tremendous generation in chiropractic, and the chiropractors rising up kind of behind us generationally, I think will have the most impact in the world for this profession. So I think it's very important that we equip them and mentor them and just take on that role as being, hey, here's some things we've learned that don't do it this way, do it this way. Just learn from us. Don't go make that mistake. Don't rewrite the book. Just do it this way and it'll work. But I think if we really equip them and encourage them to get out there and keep what we've begun going, I think everything will change. But I do think they're probably the most important generation to execute that plan. And I think those of us who've been out in practice 20 or more years already, I think we're the most important generation to equip them. And I think we can't fail that. We've got to rise to that challenge.
Just really quickly, is there anything that you've seen, books or courses, or it could be coming from the chiropractic profession or not from the chiropractic profession, that you really think could be beneficial or helpful for a student to go and explore for themselves?
Oh gosh. Oh, that's such a good one. I'm an avid reader and audiobook listener to her. So I listen to a lot of faith-based things, and I also listen to a lot of neurology and nutrition things, like clinical nutrition things. Right now, there's not one book that's standing out to me, but there's probably a list or so that I could post or that I could get to you that you can have for your resources, because there are so many. That's a hard one to narrow down.
Can you elaborate on clinical nutrition and how that actually presents itself? Like how do you kind of approach the study of clinical nutrition as maybe a chiropractic student, maybe even a pre-chiro student, just to become aware of the pathway, the educational pathway that you go down? I know that we're trying to keep it subluxation centered and focused on chiropractic, but you've mentioned clinical nutrition 2 or 3 times, and I'm just wondering if you could kind of unpack that for people to understand what it is, how you practice it, what is the actual experience of delivering a clinical nutrition service to somebody?
Sure. So I did mention a couple of times, because it is, again, a secondary passion of mine. We do it in the clinic, but I also have an online weight loss program that's faith-based that I've developed. So that's one entry point. I think if someone's really wanting to look into clinical nutrition as a student, your best starting point is to, when you do your general nutrition classes in chiro school, see if this clicks with you. See if you're passionate about it. See if it resonates. See if you at least understand. You got to at least understand the basics, because you're, as the community healthcare leader, you've got to be able, when your patient comes to you and say, hey, should I eat this or should I eat this? You at least have to have a general understanding of which the body was made to be fueled from and which it wasn't. They're at least looking to you for that. But a lot of times people are getting their health information from the wrong resources. Like they really are thinking that, a frozen Weight Watchers meal or whatever that they cook is in the microwave is as healthy as a salad and a piece of salmon. So you at least have to know the basics of helping them learn, hey, God made food is good, processed food is bad. Those 2 categories, if you know even that much, you're going to help a certain segment of people. In the office, we dive deeper into the clinical nutrition. We do a lot of testing. We've got gut testing and hormone testing, and those type of initial testing protocols at least give you a starting point for a patient. So that when you're talking clinical nutrition, that's a little more specific. So you're saying, you may start with a symptom survey or whatnot, and the patients at least can identify, based on what's going on with them, what category they're going to fall in. Hey, is this a gut issue? Is this, general malnutrition, or is this toxicity, or is this, hormonal? And then you can begin testing protocols in that area. And then all we basically are doing is, once we get those test results back and we know where the problems are, then we'll recommend either supplementation or we've got a unit called IHT. It's a bioscan unit. It's frequency retraining. So they may need some of that. If it's allergies, we may run some food sensitivity testing. So we do try to really help them. Once they're going with chiropractic, we do try to also intervene nutritionally and help in any way that we can to support the body's healing or correct, imbalances that have already arisen over the course of time. So that's kind of the clinical nutrition. We do a lot of testing for our testing protocols. Right now, we use Vitalio for a lot of our, blood work and a lot of our saliva tests. We'll use that, and then we do have some other testing protocols that we use. There's a couple good ones out there, but I think for a student, really just pay attention in those nutrition classes and see what resonates with you. And if you want to dive deeper, usually that's going to be post-grad work, or you can get some specific certifications while you're in school. Do you need them? Probably not. I mean, you can do the basics without that. Nutrition's in your scope of practice in most states. Now, it is in our state, so we dive deep, and you can dive as deep as you want to dive in that. But most of that's going to have to happen post-grad through your own study and research. So if you have a gear towards that, then when you're doing your postgraduate work, your CECs and whatnot, just pick those classes and start to get really good at that. And then if you want to specialize in it, then you'll need a little bit more training, or get with someone who already does that in their practice. Go spend a week with them. Go spend 3-4 days in their clinic and watch what they do and observe and take notes and video them and figure out what's going on there, so that you can see if that's something that you want to implement in your practice. So yeah, I mean, you've got to love what you're doing on some level, right? And nobody loves maybe paperwork or whatnot, but if you really love helping people, you're probably going to have a natural bent towards wanting to do at least a little bit of nutrition. Now, you may not want to go as deep as I've gone in it, but you might. So yeah, those resources are definitely out there. And there's definitely a way to stay subluxation focused and add these things to an adjunct. It's just, if it's who you are, it's going to come out. It's going to come out anyway. And people are going to very clearly see, oh yeah, they believe this first, but they also think this is important, and I'm going to pay attention to that. Now with my online programs, we don't do as much testing and whatnot, just because a lot of it's online only, and it's group, and it's, I don't, they're from all different states. My clients are, so I don't necessarily do a whole lot of testing with them, but what I do is refer them to someone in their area to have those testing protocols done where they can be properly overseen.
Mm-hmm. And then as we wrap up here, this project is trying to bring an awareness that pre-chiropractic is an excellent opportunity, because you have more time than you do in chiropractic school, and you have even more time than you do when you get out of chiropractic school.
Yes.
Can you kind of imagine what it would be like if we had every incoming chiropractic student go through a pretty intensive, or at least comprehensive, outlook on the profession, the career pathways you could take within the profession, what chiropractic is, and like actually engaging in the study of it, so that when they make this decision to become chiropractors, they have shared experiences that no matter what school they go to, there's more respect, maybe because the incoming students have these shared experiences, have like connected with each other in the idea of like supporting each other's pre-chiro club, or capstone projects that illustrate like this new population that we're trying to grow. Because you can attest, there's not really ever been a focus on pre-chiro students to do more than just go through the process of the admissions,
Right. Well, and I think it's critical. I think it would make a tremendous difference, because this is not for everyone. This profession is not for everyone. And I think those of us already out practicing and weigh in on this. Let me know if you agree with this. But I think if you're not supposed to be a chiropractor, go find something else, because it's it's really creating. I think we need more unity in this profession. And I think if people really understood it better before they got into it, I think some people would choose to stay in it, and some people would say, hey, this is not for me. I'm not cut out for this. I want to do something else. And I think that we would welcome that. Of course, we want everyone to be chiropractors because we love it and we're passionate about it. But boy, if you get in this and this is the wrong fit for you, it's going to affect patients. And I'm not okay with that. I'm not okay with poor philosophy being shown out there because it's hurting people, and it's not helping us as a profession to create this unified message. And I'm not saying we've all got to be exactly the same or believe exactly the same thing. In fact, I don't think that. I think the diversity is part of what makes us so beautiful and so unique as a profession and as a healing profession. We've got to have that. We've got to have people that are really great at upper cervical work, and people that are really great at nutrition, and people, and not any one of us is going to be the best at every bit of it. Like if I've got a PT situation, I'm going to refer to my PT because I know enough to help someone, but not as much as she's going to know about it. So I think that team unity is really important. I think we don't really need to compete with each other. There's enough patients out there for every single one of us. And so we can refer back and forth. We can create not only camaraderie, but groups that students can come engage with and really ask questions and ask us the tough stuff that they're not going to really hear about in school. Like, hey, how does it affect your family when when you start by the clock and end by the patient? What does that mean? What does that look like? How do you figure out those things? And when something like COVID hits and you're in a state that you had to shut your doors, we've got a couple of tremendous offices, at least through Christ Center Chiropractic, that they not only kept their doors open in New York, but they absolutely thrived and absolutely took off even during that obstacle. But if a student doesn't know that, and they shut their doors without talking with someone that says, hey, wait a second, come here, there's something else you can do, then I think that we're doing them a disservice, and we're doing the profession a disservice if we do each other one. So I really think it's impactful for students to have groups of mentors that they can communicate with on some level and bounce some things off of and get some advice and get some tips and some suggestions. And I also think, again, it's important to have hopefully some sort of mentor or consultant that you're working with that helps you navigate your specific situation. I remember when I first got out, or when I first joined AMC, I was a single mom at the time, and I wanted to homeschool the first part of the day and practice the second part of the day. And I had so many people telling me, there's no way you can do this. There's no way you can do this. There's no way you can do this. And I was like, though, there is a way. I've never met a problem that didn't have a solution. I'm not asking you if I can, I'm asking you, how can I? Show me how. And so anyway, it's a long time ago, and my husband and I, now we have a young child now. And so he's been with me for the majority of practice. But when I first met him, I was going it alone for a while. And even at that, there was a way through help, through assistance, through training, through people coaching me through, hey, this is going to be hard, but sure, you can do it. And here's what those hours need to look like. And here's how that needs to happen. And I was able to do it very successfully, even for several years. So there's always a way to develop the life that you want around the practice of your dreams. Don't ever let anyone tell you that there isn't. But we'll always know how to execute that plan. And that's where hopefully where we can come in.
Mm-hmm. And then just sorry, I keep saying it. And then just I'm cognizant of your time this morning. I really appreciate this energy that you've brought to us this morning. A new thing that came to me yesterday was that we need to position students or provide students with the opportunity, chiropractic students, to mentor pre-chiro students and get them into this mindset that they do have value and that they do have insights to share, and almost like coach up or consult with prospective students. I'm just curious, like, what that relationship looks like, just because you have had so many coaching relationships and so many consulting relationships of you being coached and you delivering the coaching. Is there any advice that you could give to a chiropractic student to really take interest in a pre-chiro student and help guide them and support them on their path?
Yeah, I think the best advice I could give is part of your growth is always going to come down to you having someone who's pulling you up and you having someone that you're pulling up. Okay, if that makes sense. But that because you're sowing, those are seeds that you're sowing, and you're going to reap those in your own life. But it also builds your conviction level about what you're doing when you're training someone, when you're imparting into them, you're energized in that as well. And you'll see it even when you're teaching your patient orientation classes. A lot of times, yes, you're teaching it for them. You're educating them and bringing them some exposure that they wouldn't have had if you wouldn't be opening your mouth and teaching them. But you're also building your passion for it. You're igniting it. You're doing it for yourself as well. You're building your conviction level as you do that. You're reminding yourself of these principles that got you into this in the first place that can get lost in the shuffle when you have a hard, long day. So I think it's always helpful because you're sowing and you're serving, and that's always going to come back to you. And it doesn't, I wouldn't suggest it to the point where you're eliminating your focus, but if you have someone that's coaching you and then someone that you're, hey, whatever you learn, you can teach them. And then it just creates this flow of positive energy that is a force that really people can't stop. And you don't have to know it all to help someone. Just as soon as you learn something, teach it to someone else, and then you've helped them, and then they can help someone else learn the one thing that you taught them. So I think it's very important. I think it's very helpful. I think it keeps you motivated and energized. It helps you stay on track and accountable, and it creates some synergy that I think we really need.
Thank you so much. That was amazing. Appreciate that.
You're so welcome.